Hi, I'm Dr. Jason Gray. I'm the founder of My Rehab Connection, and I'm also a chiropractor at Gray Chiropractic Spine and Joint Clinic located in St. Catharines, Ontario. And here I want to talk to you a little bit about hip pain, or more specifically, I want to talk about non traumatic hip pain, as this is primarily what I treat. Now, examples here would include things like piriformis syndrome, gluteal or hamstring tendonitis, bursitis, most hip impingement syndromes, and osteoarthritis of the hip would also fall into this category. Now, these conditions are quite different than acute or traumatic pain, in which damage and injury occur all at once. Instead, these non traumatic hip conditions develop very slowly over time, and they seem to just kind of surprise us because there isn't really one thing in particular that seems to cause the problem. Symptoms just kind of show up one day, or if there is a trigger, it's often with something routine that we would never expect to cause a problem. And I think it's important to take a moment to explain why this happens and what is actually causing these hip conditions. And one of the really critical things here is recognizing that with these non-traumatic hip conditions, that we don't just have one problem, we actually have two. Let me explain. Traumatic hip pain doesn't start out as an injury. It starts out with things like subtle muscle weaknesses, limited flexibility or muscle imbalances, and this especially occurs in the deep muscles that control and stabilize the hip joint itself. Now, at first, these subtle problems go unnoticed because your body is very good at compensating. For example, if one muscle is weak or lacks endurance, your body will just use a different muscle to make up for that weakness. Likewise, if the hip lacks flexibility in a certain movement or direction, the body will compensate by moving in a different, albeit less than optimal way. But these compensations have a way of catching up to you because they create abnormal stress patterns and microtrauma in and around your hip. And over time, this microtrauma can accumulate, and if left unchecked, will develop into larger scale damage, pain, and injury. So as I said, when dealing with non-traumatic hip pain, we really have two problems. We have damaged muscles, tendons, or ligaments that need to heal and be rehabilitated. But we also have to address the underlying movement problems, the strength and flexibility deficits of the deep muscles around the hip. Remember, even these are the root causes of the microtrauma and the overload. So resolving the condition is going to be quite difficult if we only focus on the pain itself. Okay, now let's talk about how we go about treating these non-traumatic hip conditions. And first, let's talk about some of the hands-on treatment that is done in the clinic itself. Here, my primary treatments include specialized treatment techniques such as active release techniques and functional range release. Now, these are both hands-on soft tissue manipulation techniques that allow me to create a very powerful stimulus to the affected muscles, fascia, and ligaments, and help promote healing and remodeling in tight, damaged, and scarred tissue. This means these techniques are very effective at both helping to promote tissue healing, as well as releasing tight muscles and ligaments that are restricting flexibility and normal hip motion. And because these are hands-on treatments, one of the most powerful benefits of using ART and FR is that it really allows me to target muscles in a very direct and very specific way. And it allows me to get to the deep muscles that surround and control the hip in a way that is far better than what you can do on your own, which is why these are the primary techniques I use when treating non-traumatic hip pain. As effective an ART and FR treatment can be, it alone is not going to be enough. You're also going to have to do some work as well, because home rehabilitation exercises also need to be a major part of treatment. These exercises need to not only target healing and rehabilitation of the injured tissue, but they also need to address the underlying causes of that damaged tissue. Because the way to understand the specific strength or flexibility impairments related to each patient is to go and find them. So when I see non-traumatic hip conditions in my clinic, I'm going to take every client and patient through a very full examination because I want to know not only what hurts and needs to heal, but I also want to uncover each and every aspect of that hip, not just what hurts, but also any and every mobility limitation, imbalance, or weakness that also needs to be addressed. It's these tests that allow me to develop a very specific home stretch and exercise plan that is specific to each individual patient or client. And with each patient or client, I am going to take the time to not only customize these rehabilitative exercises, but I'm also going to be very picky about how these exercises need to be done. Remember, we can't just reinforce the movement and muscle compensations that have caused the problem. We need to do the right exercises the right way, at the right time, and with the right effort and intensity to accomplish our goals. So it's my job to help you to know what you need to do, and then it's going to be your job to do it. And to help with these exercises at home, I set all my patients up on the My Rehab Connection app. This is a free app that I created to allow you to access written instructions, pictures, and videos of your specific exercises at home. Now, if you feel that this approach sounds like something that would be helpful for a hip problem you may be having, then I want you to call my office and my staff will walk you through how to make an appointment. But before you pick up the phone, I also want you to keep a few things in mind. First, while I do believe the approach I have outlined here offers the most complete treatment solution, please understand that this is not a quick fix. Things like tissue healing and building flexibility, strength, and muscle balance takes time, and it takes work and effort. Of course, each patient and each condition is going to be unique, so I can't tell you here how long treatment for your specific case might be. But with that said, I think it's fair to say that typical treatment plans will often fall in the 6 to 8 week range. In terms of in-office care, treatments would typically be scheduled twice a week and then would reduce in frequency in the later half of the treatment plan. Now, in terms of home exercise requirements, this would often be around 30 minutes a day. So please consider this, and if your schedule does not allow for this, you may need to rethink this approach to care.